Good morning. I'm Dr. Gaye Carlson, President of the American Academy of Child and Adolescent Psychiatry, with number 26 of our Screenside chats for our AACAP members. My goal with the chats is to share timely clinical practice and other important information from experts on key topics during the COVID-19 pandemic. Reminiscent of President Roosevelt's fireside chats during the Great Depression and World War II, I've wanted the topics to be informative, timely, interesting, and even comfortable. Today's topic returns to a focus we've had on the theme of diversity, equity, and inclusion, this time with a spotlight on anti-Asian racism. We've seen on the media how this has been affecting our country, like many situations exacerbated by COVID-19, but present long before. My guest today is Dr. Warren Ng, professor in the Department of Psychiatry at Columbia University Medical Center, New York Presbyterian Hospital, where he's the Director of Child and Adolescent Psychiatric Services and Medical Director for the Outpatient Behavioral Health. He's also AACAP's President-Elect, my right hand on our executive committee. Formerly Treasurer and Chair of the Assembly, he is no stranger to AACAP contributions. He also serves on the APA's Council for Children, Adolescents, and Families. He's passionate about public psychiatry and has helped develop primary care, school-based and community-based services for children and adolescents in Northern Manhattan, bringing high-quality psychosocial interventions to underserved communities, especially for ethnic minority youth and their families. So Warren, what have you witnessed in New York regarding anti-Asian racism, and has it changed over the past year?
Thank you, Gaye, and thank you so much for inviting me to number 26 of this incredible series. And I think it really, I'm just going to make a couple of comments just because I'm so inspired by you, but also with what you've accomplished and what you're doing. Just want to thank you for your inspiring leadership at this time, especially in a time when we've needed the light. You've definitely been the beacon of hope and inspiration. And thank you so much for also creating this presidential work group on health equity and combating racism, because within that umbrella, really of care and concern, the anti-Asian racism, as well as some of these issues that we're talking about, are so relevant. And also thank you again for the powerful statement acknowledgement of solidarity with AACAP, standing together with our Asian American community, because those things mean so much, and you make such a difference in terms of our leadership, our organization, and how we are seen, but also how we're heard. So with all of those things, I think it's hard not to make a plug for all those wonderful things that you've accomplished and done, because it's really so impactful. And when I think about this past year and you're asking me, you know, what have I experienced and what have I seen? So much have been also what has been done and what has been responded to. And I think AACAP's AAPI, Asian American Pacific Islander Resource Library, and online resources and the anti-racism website areas are so important for all of us. So those have been my go-tos, especially during this time, in terms of seeing what child and adolescent psychiatrists are thinking about and what might be most helpful for us at this time. So I think as I'm going to start, I think one of the things that we often frame a lot of our discussion is that sort of Asian Americans are an incredibly heterogeneous group. So please apologize. I'm apologizing in advance for any generalizations with regards to any comments or statements, but it really represents over 50 ethnic groups in over 100 languages, and really appreciating the fact that, you know, some of these ideas and concepts are really helpful for us to understand in the context of how it relates to the Asian American experience that you're facing in your particular situation, the patients, the families, etc. But what I've witnessed in New York, to answer your question, and particularly in the past year, is that it's really gone through various stages during the pandemic. There's been different waves of racism related to the different experiences, particularly with the COVID-19 pandemic. I think first and foremost, racism is a part of our experience, as you mentioned, at the outset, these are the concerns that have been present, but at varying degrees. But it also hasn't been present in the same way that it has been in the recent past, with really escalation beyond verbal and microaggressions to really violence and hate crimes. And that's new, or at least that's worse than it was before. But in the past year, I would say that it's interesting. When you think of New York City, you think of this huge sort of melting pot and incredible diversity. However, actually, it's been in New York City, out of all of the major cities in the US, where the data has definitely shown that the hate crimes and anti-Asian racism has actually been much higher than some of the other areas, whether or not that has to do with reporting or not. But it definitely has been stark. So across the country, anti-Asian hate crimes and racism has increased by these reports by over 150%. But when you think about New York City alone, which I think of, this is my home, this is the place where I feel everyone belongs. It's so shocking in many ways, representing our unique times, that sort of anti-Asian hate crimes has increased from 3 incidents in 2019 to 28 in 2020, and that's about an 800% increase if you think just about the raw numbers. And just even in the first quarter of this year, of 2021, there's been a 169% surge across the country. But in terms of New York City, there have been 42 hate crimes already in the first quarter compared to 13 in the last year. So I think that what we're seeing is more of a trend, but also in terms of concerns around, you know, what's happening within our communities and how are people suffering in many different ways, and how is this expressed sometimes in discrimination, in hate crimes, as well as other things. But I just wanted to appreciate within New York City, which is, I think, the greatest city in the world, and I know I'm biased, but I definitely, it is concerning.
You know, I have to say, when I asked you the question, I'm embarrassed to tell you this, but you know, I live in New York. I watch the 11 o'clock news, and so we're watching the same news. And you know, every night it starts off with where the fire is, who's been assaulted, et cetera, et cetera. And you know, fortunately, those things don't happen that often. I mean, if you watch the news, it's like you go out your front door and somebody's going to assault you, and that's not what happened. So I have to tell you, Warren, when I asked you about it, I was thinking you were going to say, oh, it's greatly exaggerated. I was saddened and humbled when you said, it's a problem, and I've experienced it personally. So I guess it's different in a way, perhaps, from African American or from other minority assaults, in that those have been pretty chronic. And what you're saying is that this isn't like new, but it's clearly different and worse than it was before.
Yeah, I think that it's a different level. And I think, as you were mentioning, particularly in the past year with Black Lives Matter and the anti-Black racism and the systemic and structural nature of all of those things embedded within our system for over 400 years, I mean, those kind of, the impact is really baked in terms of the racism. In terms of the anti-Asian sentiment, I think one of the things that has been so surprising in many ways is just how overt it is. And that's been a change. And I think that, you know, it reflects also our times, as well as sometimes our government leadership and hate rhetoric, and also permission to use words that would otherwise not be sort of acceptable in other ways. But it's definitely been a change in the tone and the tenor and the intensity.
Yeah, no, I agree with you. I think that things that you might have thought before, you at least had the grace to keep your mouth shut about.
Yes.
At this point, there does seem to be a permission. Do you think there's a certain amount of blame placing? I mean, to some extent, we always look for somebody to blame. It's somebody's fault that something bad has happened. And so the fact that the virus originated in China doesn't help. I mean, maybe if it had originated in Paris or I don't know, someplace else, you know, they would have been singled out. But I suspect I suspect the normal tendency of people to look for somebody to blame is part of it, and then the permissiveness to do it and get away with it. I don't know. Do you think are there any other components to it, do you think?
Oh, yes. And I think when we look back, I mean, there are so many examples of scapegoating and laying blame. And one of the things that's unfortunate is that any marginalized group or any group can be affected. So it's not necessarily just with Asian Pacific Islanders, but I think that with regards to how Asian Americans have experienced this kind of scapegoating has definitely been a part of the history with the Chinese Exclusion Act of 1882 or the internment of the Japanese Americans during World War II in 1942. And there's sometimes what's so difficult is that you can't choose how you look. You don't choose your race or your ethnicity, and yet at the same time, how you're seen and how you're perceived is really based just on that and not who you are and what you might represent otherwise. And so I think that the scapegoating has definitely been a part of how do we channel some of the fear, the anxiety, and all of the grief and experiences that have happened during the COVID-19 pandemic. But how do we channel that? And that, unfortunately, has become in many ways weaponized towards people channeling their affect and their emotions and across racial and ethnic lines. And we've definitely seen this with other groups, Black Lives Matter, and also the racial concerns around justice have definitely brought that to the forefront as well. So I just think that what you're saying makes so much sense, and yet at the same time, it's so much a part of our history, and it tends to repeat itself, unfortunately, without us being mindful of what we're doing.
Yeah, you know, actually my glib comment about if it had started in France, it might not have made so much of a difference, because I think looking different makes you, whoever it is that's looking different in the particular area is an immediate target. So I imagine if we were in China or Korea or India or Asia or Japan, someplace where I would look different from them, it might end up being the same thing. She's the one that looks different. So I'm sure there's something to that. How do you think it's been affecting children that you see? Has there been a particular impact on and I agree. I understand that Asian is just a huge term, but we'll use it so that we don't have to list 55 places. Has it been a particular impact on children?
Definitely. Well, and I think that this is where I would love to also highlight AACAP's incredible resource online with regards to sort of Asian American resources with regards to this, as well as also the anti-racism online resources as we're looking at it more broadly.
Let me just interrupt and say, those will be made available to you at the end of this broadcast. And
hey, there you go. Well, because I find that they're just, when you're asking me, I'm thinking, oh my goodness, the resources there are so helpful, because part of it is also being aware of what is available, but also as child and adolescent psychiatrists and also for children and adolescents, what are some of the things that we want to be mindful of? And I think one of the things that we definitely appreciate in addition to all of those tools, is really the fact that there's a wonderful publication that was published in Pediatrics, the journal Maria Trent, who talked about the impact of racism on child and adolescent health, and really seeing it as a core determinant of health for children and adolescents, and how racism has this impact not only on the biological mechanism that emerges from chronic stress and increased prolonged levels of exposure to stress hormones and oxidative stress at a cellular level, but from a societal level, definitely really important in terms of understanding the effects within individual children, adolescents, families, and communities. I think within the Asian American experience, some of the things that I've seen with regards to, like, when we're talking about schooling and children, and how many Asian American children have opted into on-site schooling. About a quarter of those surveyed of parents as well as children felt anxious about wanting to go to online school, to on-site schooling, for fears of bullying as well as racism in terms of microaggressions or other things, and also for safety. So I think that how it impacts sort of children and adolescents is really important, also in terms of the media coverage and how it's portrayed. And I think seeing horrific images is one thing, having awareness and change is another. And so I really think about how can we best sort of improve what we see as being the important outcomes. But I think from a child and adolescent, for how it's impacting children and adolescents, I think the thing is that what we always talk about as providers is what's going on, and being able to take the time to listen, to learn from that individual young person, what they're thinking and what they're going through. There's a lot of things on social media that may not make a lot of sense, and a lot of things that might actually be making things more difficult. So understanding what's happening to their peer group, and also their family experience. What are the parents going through, and whether or not they're the ones, because I speak to many of my peers and who have young children and also older children, and a lot of how they're coping with this as Asian Americans is also influencing how their children are feeling safe, secure, what can you do, and really focus on some of the resources that are available so that you're not having to not know what to do to make things better.
How would you suggest, and I believe I asked this question to some of the our African American colleagues that I've interviewed, as a racially different person from the person that you're interviewing. Okay, so it can go from you to, you know, a non-Asian person, or me to an Asian person, or a Black person, or an Indian person, or whatever.
Yeah.
How do you suggest that the different person ask the child about that experience? Suggest some language that might be a good non-threatening opener for getting a dialogue going.
Well, I would say that once again, there's an incredible resource on the website that is exactly titled Issues to Consider When Engaging AAPI Youth in Psychiatric Care, that was actually created by Ron Lee and the Systems of Care in AACAP's Youth Advisory Group. So I would say that I'm not going to cover all of those important points in terms of what is helpful, but there are 10 principles that they outline, which I think really resonate with how we can approach this. And it's really being aware of language, acculturation in terms of the cultural aspects of that presentation, cultural humility, respect, understanding parent-child dynamics and how it might be different from a cultural perspective. What are the strengths, the vulnerabilities, as well as thinking about home and community-based interventions, ethnic-specific institutions and organizations, and adapting any evidence-based interventions. But I think as you're saying, what can we say? I think one of the things is the first thing to say is to say to yourself, be curious, be open. And what are some of the assumptions that I might have even before I see the child or adolescent or family, in thinking about how can I be mindful of that as I'm entering this situation, and not to have as many of those assumptions and our implicit bias that might be a part of that experience, but just open to listening and learning what this unique child and adolescent, how they're experiencing it, and open to their interpretation of it as well. So I think just that posture, first with ourselves and then with the young person and their family, because we have acculturation issues. I mean, I think that there are AAPI young people who grow up who don't even think of themselves as Asian until someone tells them they are. And that's so true of like how you identify. And so I think what's important is just understanding from their perspective, sort of what's important to them and how they view it, because it might be very different from what we see.
Different question. I have to say, you've my naivety. We were talking at one point about the model minority myth. Tell us about that and where the truth lies.
Sure, and that's such a great question. And I have to say that it's been really eye-opening also for me to hear how other people have been thinking about the model minority myth. And I've been in groups where I've been sort of discussing this, and there are people who tell me, I didn't even know that there was anything negative about the model minority myth. I thought it was just all positive. And I think when we think about that, that's exactly where understanding some of these important issues are, because the model minority myth is really a set of stereotypes that attempt to define a group of people, particularly Asian Americans, in an experience which says that they are either hardworking, law-abiding, good at math and science. They do what they're told. They stay in their lane. They don't make trouble, and they're very resourceful. And they really don't need any additional kind of resources that might be important. And yet at the same time, that has been such a myth and so incorrect. In many ways, I think of it as the gilded cage, as well as sort of being boxed in, because it's not an identity that resonates with many Asian American folks. But at the same time, understanding that Asian Americans represent the racial and ethnic group with the highest sort of disparity between the highest earning and the lowest earning people socioeconomically, and that a quarter of all Asian American New Yorkers live at the poverty level, which we don't often think of, because we think about those sort of media portrayals of the crazy rich Asian, and you're thinking like, you know, how is this resonant with that? But I think from a child and adolescent perspective, and thinking about the model minority myth, what we call it is that it's a microaggression and also an ascription of intelligence, as Dr. Daryl Hsu reports, in terms of assigning sort of one set of attributes, whether positive or negative, to one group, but in a way it also pits them against others. So it's almost saying that Asian Americans are this, therefore other people are either less than or greater than, but it's always relative to another group. And I think that that also creates tensions within communities of color. And actually the model minority myth was actually close to World War II and afterwards, and it was used to determine how some Japanese Americans were doing so much better without any public assistance or additional services, and how then in contrast, Black Americans might not be doing as well and might need more support. And it was almost pitting two groups of people of color against one another, but also then creating animosity between the groups around who has specific privileges and how that might be different. And I think that that also then creates other dynamics, but what it does is it creates differences based on people's color and race and ethnicity, which is not true, because race is a social construct. There is no biological determinant underneath it. And so I think when those things happen, it creates other problems. With young people, I can just tell you that I'm an identical twin. My twin brother was never good. Well, he never attended himself to math and sciences. He was an artist. He's a visual artist, and he's incredible at it, and he's so successful. But at the same time, not fitting in that sort of model minority myth, people just thought of him as being lazy or not smart, and since I was the one in math and sciences, it was like, okay, one twin versus the other. But I think it's like an irony, because then what happens is that young people feel like they're not valued because they don't fit this niche that they're supposed to be. And yet at the same time, maybe I'm dumb, maybe I'm not smart, and maybe I'm not talented. But I think that these model minority myths create challenges for young people, because no one should be meant to live in a box, and yet at the same time, it's a gilded cage, because sometimes the perception is that there is privilege and that there is access, but those don't necessarily connote to equality and humanity and experience.
Well, I have to say, Warren, maybe the good thing about this is that I don't think those things would have ever crossed my mind. Okay, I think it's only when you have this kind of dialogue that you say, sort of gobsmacked. Oh my, I never really thought about it like that. I was talking, I don't know if you know Manpreet Singh, but
Oh yes,
yeah. So anyway, we were talking about this the other day, and I walked right into the stereotype, and I said, you open our Three Village Times, our local newspaper, whenever the Westinghouse or, whatever the thing is called now, prizes are. And I would say 3/4 of the faces on there are Pacific Islander, Indian American. They're not WASPs, okay? There are a few little WASPs, white Anglo-Saxon Protestants. There are a few WASPs in there, but not many, okay? And so for me, I fell right into that. I fell right into that, Warren. And so I guess I just never, it really never occurred to me that you're sort of stuck there when you say, hey, I'm not that. I have other things that I can do, but I'm not that. So I appreciate it. I appreciate your candor. I appreciate the opportunity to be able to talk about that. Do you think, and again, this is one of these global statements, and it's probably a good wrap-up thing. When you become president of AACAP, what are you going to do to address this?
Well, what I'm going to do to address it is follow your lead, Gaye. You have created such an incredible platform, but you've also really shone the light, as you mentioned, not only on what we need to do for others, but what we need to do for ourselves. And part of that humility that you model is such an incredible leadership skill, because it's really in reflection that we learn and that we change. But also, I always think of, when we think about race and ethnicity, these API issues that are much broader about racism and how we see each other as human beings. What I often say is that sometimes you look and you learn and you listen, but don't always just trust your senses, trust your heart. Because I think when we listen from the heart and when we look from the heart, we might see something different. And I think sometimes our experience, our life experience and other things shape how we have seen things, and that isn't always sort of accurate and not always respectful and not always equitable. So I think my goal, as president, would be to continue your incredible work in this area, to acknowledge that the work is never done, and to acknowledge how important this work is for all of us. It isn't for any one group, whether or not whatever rainbow color we exhibit or with whatever identities we may assume or identify with. This is really about our collective humanity, and it's really about how do we come together as our best selves to help others be their best selves. And I really think that sort of goes to the heart of all of this work, which is really how do we bring out our best in each other and in ourselves. And so I really champion your efforts as you've really led the charge on this important issue at the most important time, because we know this pandemic has revealed many things that we need to work on, and this is one of them. So I really appreciate your leadership and vision.
Well, thank you, Warren. I was thinking about the quote my daughter-in-law sent. I'm not going to be able to rephrase it well, but it basically said, giving others rights doesn't take away my rights. It's not pie. And I think that's a nice concept to end on. So I really appreciate, well, I always appreciate you, but I appreciate you at my Screenside chats. And I look forward to continuing to work with you on the executive committee. And I thank our audience for tuning in to Screenside chats. So
thank you, Gaye. And thank you for making me number 26. I'm honored and thrilled for this time. Thank you. Have a great day, everyone.
Thank you all very much for tuning in. This is Gaye Carlson for AACAP's Screenside Chats.
AACAP provides Screenside Chats as a member in public service, but it is neither a legal interpretation nor a statement of AACAP policy. Reference to any specific product or entity does not constitute an endorsement or recommendation by AACAP. The views expressed by guests are their own, and their participation in Screenside Chats does not imply an endorsement of them or any entity they represent. Views and opinions expressed by guests are their own and do not necessarily reflect the views of AACAP or any of its officials.